Joining the dialogue and bringing you today's forum is a longtime friend and president of the American Federation of Teachers, whose home we are in today. The AFT is arguably one of the most significant organizations affecting public policy in the nation. It represents nearly 1.5 million teachers and school personnel and works on a day-to-day basis to improve education for all of our families and all of our communities throughout the nation. Please join me in recognizing the President of the American Federation of Teachers, Randy Weingarten.
So I realize if I put my coffee here, it will spill. So I am delighted that can you hear me? Can you hear me now?
Yes.
So I am delighted that you are all here. I actually commuted from a pretty long distance to be here today. I was on a plane from Chicago at 6 o'clock this morning.
Wow.
So sorry that I was a little delayed. But I wanted to be here just welcoming all of you. This is not just a really important forum, but as Congresswoman Norton said, this is a complicated bill that was passed. I know I have my speaking points, but I've welcomed you. I'm glad you're here. You are amazing and terrific, and I'll just say a couple of things and then let you get on to the work at hand. This is an amazingly complicated bill.
Exactly.
And when you have an amazingly complicated bill, it is ripe for rumors and for demagoguery. We all saw the demagoguery before the bill was passed. Whether people were talking about the death panels or the one that actually pained me so much was in town hall after town hall, some of the Tea Party folk riding the crest of fear and trying to tell seniors that the government was going to take away their Medicare. Now, as a former high school social studies teacher, that particularly pains me because the government was the one that created Medicare and Medicaid in the 60s, the government that we put in office for having or to try to have a better future for all of the people we represent. So in watching those town halls, in watching the proceedings on the House floor and the Senate floor, while this bill was being, I love this term in Washington, made into sausage, while this bill was being passed, what many of us realized was that it takes not simply advocacy, but organizing, mobilizing, and educating so that people first know what's in the bill, and then second, can access what's in the bill. And that's why this dialogue is so important, because it is part mobilizing, part organizing, but most importantly, educating so that people can access what's in the bill. So what was really the underlying fight? Underlying fight is this bill ultimately changes income distribution in the United States of America. Because what this bill does is says, in a very complicated way, that people who have not had access to health care will gradually get more access to health care, while the people who have access to health care keep it. So those who country the way it is, maybe those who brought us the recession, they didn't want the government to spend more money on people who don't have access to health care now. Stripped of everything else, that was the debate. Not dissimilar to the debate in education. Instead of lifting all boats by creating resources and quality teachers for all, they wouldn't mind just helping a couple of kids. It's the same thing. So our job and your job today is really understanding what's in these bills, or this bill and law, and helping in a thoughtful and reflective way to make sure people understand it and they can access what's here. I remember talking to folks in New York City who I used to represent about the donut hole. We had a lot of retirees. I used to be the president of the United Federation of Teachers in New York City for about 12 years. We represented a lot of retirees. And remember a few years ago when they had, when the Bush administration kept saying, look, I'm giving drug care to all these elderly folk. People would say, oh yeah, but what's this donut hole? And our health plans were not able to subsidize the donut hole. There was a real donut hole. And in telling retirees that we had fought to, over the long haul, get rid of that donut hole, they got it. They got why it matters that groups as diverse as all of ours in this room fought hard to create social and economic justice for those who can't and don't have the power to speak for themselves. So thank you for allowing us to host you today on this very important education and access pursuit for healthcare for all.